Mercy ACO, we have been around since 2012 and started off very small, but have experienced tremendous growth in 6 years.
Today we own and operate roughly 8 medical centers across the state as part of our Mercy Health Network system. Mercy Health Network roughly sees about 1 million patients throughout our network.
So we were doing the population health work for a long time before that. By that I mean taking care of patients as a population of patients, looking at all your patients who have diabetes as a whole and seeing what percentage of them are controlled, what percentage of them are overdue for care.
We have over 100 ambulatory health coaches. These are coaches that they're RNs and LPNs primarily that are embedded in primary care. We are kind of just making best guesses of what we thought made sense to do to take care of a patient. And then some of the IT systems that we did have just did not support a population health perspective. They were really, the medical model and very siloed and stagnant.
A majority of our reason for our transition to the Innovaccer product was a lack of transparency in the data and the information and how it was being handled.
We're learning new things every day that we didn't know before, because now we have the data and we can take that data and look at the outcomes and have a good idea of where the gap is. More and more work has become standardized, but it's also led us to be able to look at where there are different things going on, that we can look at that and compare and say, really, the way they're doing this in Sioux City is the way we need to have everybody do it. One of the biggest things we focus on are the transitions in care. So patients coming out of the hospital back home. And we're really looking at warm handoffs between the acute care case management team and the ambulatory care management team so that patients don't fall through the cracks. So that's a huge example for me of how we can see we have reduced readmission rates, we have reduced complications, we've reduced costs. I mean, we can put all of that together and point directly to the fact that having a pretty robust, aggressive transition program has been part of that difference.
The impact on the patient is really around that standardization of process. So they have a standard experience when they're engaging with their health coach and care management team.
Our ACO has 6 different markets that we're in, and in each market we want to be able to take their own risk. And now we can measure how they're performing so we can assign the risk back to them.
We've had a lot of innovation going on and different people trying different things across the state. And what Innovaccer has been able to bring to that is some rigor and some good evidence as to where we need to go.